Dr. Amit Thakur, he is the president of the Africa Healthcare Federation and chair of Africa Health Business. Thanks so much for joining us here on TRT World. First of all, just remind us, how deadly is malaria compared to what we know of COVID-19?
Thank you for having me on the show. We know that malaria is the largest killer, and this is a parasite that we've been trying to deal with in Africa for a long time. And because of COVID, I think the attention from malaria and other diseases such as meningitis, Lassa fever have all shifted. So it's one of the leading causes of preventable deaths that we face in Africa. So it is quite serious.
And it's very concerning that the WHO cites figures from Africa's Ebola outbreak, showing that more people died of other diseases, including malaria, than Ebola itself, due to a lack of access for treatment. Do you think that could be repeated with COVID-19 across Africa?
Yeah, of course, we have a major issue. We have to strengthen the health systems. And if we don't have a good health system, as we try to prevent the transmission, and those who get infected and need treatment will find it very difficult to get treatment. But one thing about COVID that's different from maybe the other virus like Ebola is that a large percent of those who are positive recover, and they literally need some kind of just rest and some fluids, and they're back home. It's only 20% who may need some kind of additional treatment, and 5% will need ventilation and ICU care. So we literally have to try and keep people safe, people at home, social distancing, and that's going to be the main winning formula for Africa.
And which African countries would you say are the most at risk of maybe resources not being divided well between malaria and COVID-19 right now?
So we could name quite a few, and I would say all of them are at risk. I wouldn't really separate the countries. I think most of the countries will be dealing with both the conditions quite squarely. I know that sub-Saharan Africa, the 30 or 40 countries there would be dealing with both of them quite, they would have to deal with both the conditions. But right now, all the resources that we have and all the resources we can get are moving towards COVID-19. And I think you raise a good point. We must not forget the other conditions that will still require treatment, so we don't see the mortality of those cases going up while we're dealing with COVID.
And the WHO also said African countries have a critical window of opportunity to minimize disruptions in malaria prevention. How long is that critical window?
I wish I could tell you, no one knows, but I think these 2 months are the critical window. I wish we had started these preparations. But some countries started in February and others in March, and some are still trying to prepare. So I think we have this window of 2 months, the time that we've got, what we've learned from other continents to strengthen the health system and to arrange our social ecosystem to ensure that we save livelihoods due to this pandemic.
Absolutely. Dr. Amit Thakur, we wish you the best with your work across Africa. Thank you for making time for us.